A peripherally inserted central catheter is also known by its acronym PICC or PICC. It's a long, flexible catheter that is placed in a vein in the upper arm. This catheter provides direct access to a central blood vessel and can be used for blood withdrawal, administration of large volumes of hyperosmolar substances such as irritant medications, vasoactive medications, prolonged antibiotic treatments, chemotherapy, parenteral nutrition, amongst others. It is also used to measure central venous pressure, CVP, and for contrast administration if necessary. The Kimal PICC for adults has 1, 2, or 3 lumens, depending on the patient's needs. Each lumen has a separate channel to administer different drugs simultaneously. Insertion is performed peripherally in the arm by placing the tip of the catheter in the lower third of the superior vena cava. In this video, we will demonstrate the placement of the Kimal PICC line using the modified Seldinger technique with ultrasound-guided insertion, starting with the assessment and selection of the vein to be used. Assessing the vein and marking it. We place the patient face up with the arm at a 90-degree angle. We place the tourniquet above the insertion site and perform an ultrasound scan to pre-assess the vessel to be selected. Once the vessel is located, we check that it is a vein by compressing the skin with the head of the ultrasound machine, which causes the vein to collapse. In this case, we will use the basaltic vein. We mark the insertion point, remove the tourniquet, and clean the patient. Once marked, we proceed to measure the patient to ensure that the catheter is the right length. Measuring PICC line. For central placement, the recommended location for the tip is the lower third of the superior vena cava, close to the cavo-atrial junction. During the measurement, it is important to position the patient correctly to ensure the most accurate measurement possible. Using a tape measure, we measure the distance from the intended insertion site to the middle of the clavicle and then to the third intercostal space. Preparing the trolley. We are going to prepare the auxiliary table with a sterile field to have everything we need ready. We proceed to open the catheter kit. In this case, we will use the Kimal PICC, 1 lumen, 5 French and 55 centimeters. Inside the Kimal PICC kit, we find a sterile tape measure, a 7 centimeter 21 gauge needle, a 5 French peelable microintroducer, a 10 cc syringe, an 11 blade, a 50 centimeter nitinol guide wire along the guide wire dispenser, an 80 centimeter nitinol guide wire with a traumatic tip that comes inside the catheter and performs the function of a stylet to improve insertion, a T connector with a detachable connector and a part to hold the stylet, guide wire, connector, a Unifix stabilization device, and a transparent dressing. Preparing the patient. Place the patient in the supine position with the right arm at a 90-degree angle. Disinfect the area with the patient's help. Place a sterile drape under the patient's arm and another drape to cover the patient. In this case, we place a sterile PICC insertion field following the markings and leaving the insertion site exposed. During insertion. Once everything is prepared, we inject local anesthesia into the area, allowing time for it to take effect. In the meantime, we apply sterile gel for the use of the ultrasound machine and ask our assistant to place the tourniquet. We look for the vein with the ultrasound machine. Once the vein is located, we proceed to introduce the needle by guiding it into the vein, observing the ultrasound image. Once we have introduced the needle and we have venous return, we introduce the guide wire through the needle. Once the guide wire is inserted, we remove the needle, leaving the guide wire in place inside the vein, and we can then remove the tourniquet. Once the guide wire is in place, we cut the PICC to the agreed size, taking care before cutting it to retract the guide wire, and reposition it to the correct level, and purge it with saline, making it ready for placement. With the scalpel, we make a small incision. We now proceed to insert the dilator with a peel-away sheath, passing it over the guide wire until it comes out the distal end. Remove the guide wire. We proceed to remove the dilator and begin to introduce the catheter through the peel-away sheath. We ask the patient to turn their head to the side, bringing their chin to their shoulder. We continue introducing the catheter. Open the peel-off protector and insert the catheter and remove the protector until the catheter is fully inserted. Remove the T-connector together with the guide wire inside the catheter and close the catheter. After insertion. With a sterile syringe, we check the lumen by aspirating for venous return. Close the lumen with a sterile saline syringe, reopen the clamp and clean the lumen, and then flush with saline solution using the push-pause technique. According to hospital protocol, the lumen can be heparinized, ensuring patency of the lumen. We then attach the needle-free connectors provided in the kit. We remove the field and place a Unifix catheter fixation dressing. Once the fixation is in place, we place a transparent dressing to protect the insertion point. Once the placement of the catheter is complete, we call radiology to perform a chest X-ray in which the doctor will confirm the correct placement of the catheter.